Hi guys, good evening one and all. Hope I am audible and visible to you. I just need a quick response on the chat box. Guys, I want your quick response on the chat box so that we'll be starting today's discussion. So I'll be focusing main on questions which are given in INICET and NEET, which are very, very important from examination point of view. Hope I am audible and visible to you. Give me a thumbs up sign. Yeah, good evening. Yeah, Pallavi is there. Yeah, good evening all of you. Just need a quick response so that without wasting any time. So let's start the activity. It will be like a half an hour. I'll try to go a little bit fast. And people who are watching it as a recorded version, you can modify your speed and language basing upon your preference. I want you to be a little active on the chat box so that we'll try to finish this as quick as possible. Make sure, please do subscribe the channel and keep your bell notification on for all the latest updates about live classes and all the important updates about various examinations and notifications. So make sure you subscribe and keep your bell notification on so that you're going to get all the updates in the form of notifications in your YouTube app. Shall we start without wasting any time? So I'll be focusing on the questions which are given in the May 2025 INICET in this particular session, along with few other important topics I'll be covering. So I want you to quickly answer the questions. Okay, right? Shall we start? Yeah. Question number 1. Which of the following is not a non-invasive procedure? So keywords are which of the following is not an non-invasive procedure. So they're asking not non-remote. So they're asking which of the following is an invasive procedure. They're asking. Simple. Which of the following is an invasive procedure? They're asking. And we know there is something called as minimal invasive dentistry, also called as MID. Father of MID is Mount. Mount is called as father of MID. And dentistry is always moving towards the minimal invasive. So like we need to damage less and get the outcome fast, in which your ART is going to come, in which your Hall's technique is going to come. Hall's technique is you're not removing decay. Okay, so in primary teeth which are non-symptomatic, what I'm doing is I'm not removing the decay, instead of which I'm giving a stainless steel crown on it. The patient is asymptomatic, so I just want my primary teeth to work as a space maintainer. So I am giving a stainless steel crown over it without doing any sort of procedure. So that is called as Hall's technique. And most of you are aware of arresting the caries lesion, particularly root caries and everything are done by silver diamond fluoride. I told you to remember silver diamond fluoride percentage is 38%. Again, a very frequently asked question in INICET and NEET examination. Coming to pulpotomy is an invasive procedure where I am going to remove pulp to prevent the infection, further infection. Okay, I'm going to remove a part of pulp or partial part of pulp. I'm going to remove, so this is called as pulpotomy. So now the question is, which of the following is an invasive procedure? The answer is pulpotomy, option C. Now jumping into the next question. Again, a very frequently repeated concept. The concept is trigeminal vagal reflex. Means whenever you are manipulating the maxillofacial areas, your trigeminal nerve that supplies the maxillofacial areas will get activated. Indirectly, it is activating the vagal nerve. Okay, so that is called as this particular reflex. So if you check out the question which is given in the examination, during the down fracture of Leafort 1 osteotomy, there is a traction on pterygomaxillary junction that can lead to sudden bradycardia, and this reflex is primarily due to the stimulation of which of the following nerve? So maxillofacial area, the nerve which is stimulated is trigeminal nerve, that is nerve number 5. So this is basically called as TV reflex. What happens in this reflex? So whenever your trigeminal nerve get activated, it is indirectly going to activate the cardio-inhibitory parasympathetic pathway of your vagal nerve, leading to these conditions. Number 1, bradycardia. Second one is hypotension. Third one, it increases the gastric mobility. And fourth one, it causes apnea. So you have 2 questions on this particular concept in the recent INICET exam. One is activation of which nerve. The second one is all of the following features can be seen in this type of reflex except, which is again discussed with you when I'm taking classes. So all these 4 options were given. So you need to identify the exception. Okay, apnea is not given. So your bradycardia, hypertension, gastric mobility was given. There the answer is hypertension. Hope you are clear with this particular concept. Again, very common repeated question. Next question, in uncontrolled diabetes, in which of the following cells there is a decreasing in the glucose uptake due to insulin dependency? Straightforward question, very simple, already discussed when I'm taking biochemistry part. So they're asking which of the following cells are insulin dependent. Insulin dependent cells they're asking. So insulin dependent part basically comes under your GLUT table I have discussed recently. So GLUT4 is all insulin dependent cells are going to come. All insulin dependent structures are going to come under GLUT4. And I told you to remember 4 cells. One is heart muscle, second one is skeletal muscle, and third one is adipose tissue, out of which you have skeletal muscle option. The answer is option B. Again, INICET, recent INICET question. Now jumping into the next one. Again, this particular concept is also discussed for you. The question is on MAC value. Okay, so MAC value, they're asking minimum alveolar concentration of nitrous oxide is 104. Yes, we have learned about this. The MAC value of nitrous oxide is 104. And what we have learned 2 values. One is MAC value. I'm very specifically talking about nitrous oxide. I learned about MAC value. MAC value is 104%. Can anyone tell me what is the blood gas coefficient value of nitrous oxide? We have learned, because again a repeated question, is 0.47. They're talking about pin index value for nitrous oxide. The answer is 3,5. If they're asking the density or specific gravity of nitrous oxide, the answer is 1.53. So all these values are very important, already repeated in various examinations. One is MAC value 104, blood gas coefficient 0.47, pin index value 3.5, and density or specific gravity of nitrous oxide is 1.53. And during my classes, I clearly told you what is MAC. MAC value is going to tell you the potency of the drug. So how it is going to correlate? MAC is inversely proportional to potency. Means the more the MAC value, the less will be the potency. So that is what I'm telling. The highest MAC value among different types of gases we have learned is nitrous oxide, that is 104%. So nitrous oxide is going to have least potency. Nitrous oxide is going to have least potency. Similarly, there is one more thing, concept is blood gas coefficient value. When I'm talking about blood gas coefficient value, I told you blood gas coefficient value is inversely proportional to onset of action or onset of recovery. Okay, more the gas coefficient value, the onset will be less or the recovery will be less. So this is what the concept we have discussed. Now here the question is, they're asking the relationship. So and they're telling it is more than 100%. I mean, it is more than 100% because it's 104%. It means even 100% of nitrous oxide is not able to provide anesthesia. So it is not a good anesthetic agent. Okay. So which of the following property of nitrous oxide does this high HMA value is mostly indicating? It is mostly indicating the low potency. The answer is option C. Apart from this, because previously INICET was always focusing on this particular area. So I want to stress few important points. Okay. So least potency is nitrous oxide. Then what is highest potency? Highest potency. What is highest potency? Highest potency is methoxyfluorine. Methoxyfluorine, the blood gas coefficient, methoxyfluorine, the MAC value is 0.16, which is least. So whenever your MAC value is least, it is going to have more potency. Similarly, when I'm talking about the blood gas coefficient value, methoxyfluorine is going to have the highest. As it is having the highest, the mode of onset and recovery will be least. The mode of onset and the recovery will be least for methoxyfluorine. Okay. Next one. Apart from this, I want you to make a note about the blood gas coefficient values of xenon, that is 0.115, and dysfluorine, that is 0.42. Okay. I hope this is very, very clear. The more the MAC value, the less will be the potency. The more the blood gas coefficient value, the less will be the onset. Okay. Okay, so I'm done with that particular concept. Moving to the next one, that is PAI index. So PAI index. Okay, so recently question asked about PAI index is directly straightforward. Scientist name they have asked. Scientist name was asked in PAI index. But of course, PAI index is like you take an IOPA and you are going to give a number basing upon the periapical lesion radiographically. That is called as PAI index. Now here the question is about PAI index 5. 5 is severe periodontitis with exacerbating features. So what happens in PA index? PA index 1 is, you can see a normal periapical anatomy. PA index 2, there is a mild change in the bony pattern. You can see a mild changes in the bony pattern in PA2. Coming to the 3, PA3, changes in the bone pattern with a diffuse loss of minerals. Mineral loss will be started in 3 and it will be advanced. Apical periodontitis with definite radiolucency in the periapical area. So you are going to have a periapical area radiolucency, and this is going to be severe periapical or periodontitis with the features of aberrating. Okay, so this is what the question which is given in the recent INICET about PA index. Straightforward question. Scientist who is associated with the PA index is straightforward question. Again, question which was repeated so many times. Okay, easy question. Fenestration dehiscence. Whenever your marginal bone is intact, that is called as fenestration, and whenever your marginal bone is not intact, then that particular condition is called as dehiscence. Dehiscence and fenestration is a very, very frequently asked question, so many times repeated till the date in the examination. Of course, it was given in the previous INICET also. Then coming to the next question. The next question is, a 45-year-old patient with a persistent asthma. A 45-year-old patient with persistent asthma has been prescribed a dosage inhaler which is containing budesonide for its daily uses. At a follow-up appointment, the patient complains of a new symptom which has been developed. Which of the following is the most common side effect associated with this particular medication? So long-term usage of your steroids can lead to opportunistic infections in the oral cavity because of their immune suppression activity. So these drugs are going to have an immune suppression activity, and that can lead to the formation of a fungal infection in your oral cavity, that is your oropharyngeal candidiasis. Then which of the following is a lightest shade? Which of the following is the lightest shade in a classical Veta shade guide? So this is what the sequence already given so many times in the examinations. So the lightest is going to be B1 and the darkest is going to be C4. So don't get confused. Lightest is B1, darkest is C4. Even the sequence was given so many times in INICET. So very, very important area if you are preparing for INICET. Must do area. So the answer is option D, B1. They're asking the lightest one. Which of the following is not classified as an anti-inflammatory? Keyword is not. Keyword is not. Okay. So you see, TNF alpha is a pro-inflammatory factor. It's a pro-inflammatory cytokinin. It's a pro-inflammatory cytokinin. Okay. So the answer is option C. Which of the following type of dental trauma is immediate endodontic prophylaxis is most often indicated? Let's check the options. One is intrusion, extrusion, lateral luxation, root fracture. Okay, right, all good. Okay, but if you check out the four options, among the four options, which of the following of these four is going to have highest chance of caries necrosis, highest chance of pulp necrosis incidence? Incidence of pulpal necrosis is more with intrusion, when compared to any other areas. Okay, over a period of time, necrosis can occur. Even if you take root fractures, they're divided into different types, out of which apical root fracture, in majority of the situations, the pulp is going to be vital always. So among the options, it is intrusion. There is a high chances of pulpal necrosis in which the treatment endodontic prophylaxis has to be started. The answer is option A, straightforward. Then jumping into few important single liners, I want you to answer on the chat box as quick as possible. Question number 1, most resistance to sterilization. Which of the following components that we have discussed are most resistant to sterilization? Most resistance to sterilization. Which components are most resistant to sterilization? Already so many times given in INICET. The answer is prions followed by spores. It is prions followed by spores. Best skin disinfectant is powdered iodine, or also called as betadine. How much percentage? How much percentage? How much percentage it is? Yes, very good. It is 10%. It contains 10% of iodine. Similarly, I want you to make a note about other 10%. 10% formalin. 10% formalin is useful for fixation. You can remember it as F and F. 10% formalin is useful for fixation, F and F. Next one, sterilization of culture media is done by. Sterilization of culture media is done by, very good. Sterilization of culture media is done by autoclave. If the culture media is going to contain serum in it, serum is nothing but protein. Whenever you are using protein, whenever you are having protein and you are using autoclave, that is heat, protein will get denatured. Denaturation of protein will occur. So I cannot use autoclave. So what I have to do, I have to use filtration. So culture media which is containing serum, if they're asking, your answer should be filtration. Culture media method of sterilization, your answer should be autoclave. Endoscopes are sterilized by glutaraldehyde, that is basically called as Sidex. 2% of glutaraldehyde is basically called as Sidex. Very frequently asked question, even in recent PSC, the same question was given. 2% of glutaraldehyde is called as Sidex. Operation theaters are sterilized by fumigation. That is your formaldehyde. Fumigation, formaldehyde. Next, autoclave. Autoclave 15 lbs, 15 minutes, 121 degrees centigrade. There is one more temperature of autoclave that you have to make a note, that is called as flash sterilization of autoclave, where I am going to use 30 lbs, 3 minutes, 134 degrees centigrade. 30 lbs, 3 minutes, 134 degrees centigrade. Then comes collagen types. So collagen types, type 1 is the most predominant type of collagen present in the human body or present in most of the dental structures. And of course, collagen is the most predominant protein that is present in the body. So most predominant protein that is present in the body, most predominant protein that is present in your entire body is collagen. Most predominant protein that is present in the blood is albumin. So see what they're asking, whether they're asking body or blood. Body is collagen, blood is albumin. Predominant type if they're asking, then your answer is type 1. In bone, gingiva, PDL, dentin, cementum, wherever you see in pulp, cementum, pulp, everywhere, areolar bone, everywhere, you are going to have type 1 collagen as a predominant collagen. And only dental structure which is not having collagen is enamel. Enamel does not have collagen. Then comes type 2. Type 2 is cartilage. I told you to remember cartilage. Type 2. Type 3 collagen is seen in the case of your reticular fibers associated with the blood vessels. Granulation tissue, where you are going to see granulation tissue, wound healing. And there are one type of fibers which are seen exclusively in the case of your mantle dentin, that is called as Vankov fibers. So Vankov fibers, very specifically if they're asking, your answer should be type 3 collagen, so many times repeated in the exam. Type of collagen seen in the mantle dentin, type of collagen seen in the Vankov fibers. Answer is mantle dentin, that is answer is type 3 collagen. Normally if they're asking what is the predominant type of collagen that is seen in the dentin, your answer should be type 1. Then jumping into type 4 is seen in the case of basement membrane or basal lamellae. Is seen in the case of your basement membrane or basal lamellae. Very frequently asked question, type of collagen which is seen in the pulp. Type 1 and type 3. So type 1, type 3 combination is seen in the case of your dental pulp. Similarly, they'll ask you what is the type of collagen which is seen in the wound healing. In the wound healing, initially it is type 1. Later the type 1 will get replaced by type 3. So normally if they're asking initial phase of wound healing, your answer should be type 1. Initial phase of wound healing, if your answer should be type 1. Normally if they're asking wound healing, we have to take granulation tissue into consideration and we have to go for the answer as granulation tissue type 3. Combination if they're asking, you can go for combination 1 and 3. I hope this is very, very clear. I just need your thumbs up sign. And one more thing that you have to make a note is chicken wire configuration is seen in the case of which type of collagen? Is seen in the case of type 4. Is seen in the case of your type 4. Next, we have discussed recently, rule of 10 is useful for the diagnosis of pheochromocytoma. Okay, so where 10% of lesions are going to be malignant. So they can ask you how much percentage of pheochromocytoma can be benign. So don't go for rule of 10. Okay, rule of 10 is malignancy. Okay, so benign, if they're asking, your answer should be 90%. Such sort of questions are also given in the examinations, particularly exams of INICET. So be clear what it is. 10% is bilateral, means 90% is unilateral. Okay, I hope this is very clear. So malignancy, bilateral, unilateral was so many times repeated. So don't blindly go for rule of 10 as a simple thing that's going to give you right answers in majority of the situations. So smart paper setter can ask you how many are unilateral, how many percentage of, basing upon rule of 10, how many percentage of cases of pheochromocytoma are unilateral, then your answer is 90%, because rule of 10 is going to tell you about 10% bilateral. So leftover 90% are unilateral. 10% of extra-adrenal, 10% of cases can be calcified, 10% of cases are seen in the case of children, and 10% are female. So be clear with what 10% is, because nowadays exams are being drifted. Okay, drifted in the sense, previously the question is very simple. Rule of 10 useful for which of the following abnormality? Answer is pheochromocytoma. You don't need to check out the options also. Now what I'm going to give a patient of this particular age and this and that, and I'm going to tell you upon some epidemiological investigation, I got to know the 10% of this particular lesions are malignant, 10% of this particular lesions can be calcified, 10% of particular lesions can be seen in the case of children. Now I'm going to correlate and I'm going to ask you a twisted question. Okay, so here we require a little depth-oriented reading. It's not a superficial reading. Rule of 10 agachalo. Now it's done. Okay, so here you need to be very clear with what you are learning. So such a sort of questions have been increased in the question paper over a period of time. So superficial reading may not help you in such situations. So whatever you are going to learn, make sure you try to be clear in that particular concept. Let it be. It's okay. Even if you learn only limited number of concepts, it's okay. But be clear with whatever concepts you are learning, because whatever concepts which I am stressing, which I am going to teach in the next 4 to 5 months before you take NEET examination, are very frequently asked areas, are genuine areas where the questions are definitely going to come from. So don't give any sort of like superficial reading or any sort of discount. Already we are doing very important areas. Again, in this, don't read superficially, read top to bottom, read repeatedly, do it again and again, again and again. So this is what I personally recommend you to follow. So if you follow such basic principles or basic fundas, there is a high chance that your performance can be amplified in the examination hall or on the day of result. Next one, other rule of 10, which is useful for the cleft procedures, also called as Millard's rule of 10, where the baby should have a weight of 10 pounds at least. Hemoglobin concentration should be 10 grams. Age of the baby should be at least 10 weeks. And WBC count should not be more than 10,000. Most of you are familiar. Then I want to talk a little about a concept in pathology. So I just want to make it as simple as possible. So basically the difference between dystrophic calcification, metastatic calcification. So whenever I'm teaching dystrophic calcification, I told you to remember D for D. So means dystrophic calcifications are basically seen in the case of dead and degenerated cases. So these are seen in dead and degenerated cases. D for D, D for D. So dystrophic calcifications examples are associated with dead and degenerated cells. Okay, same goes. Like even if you take pulpal necrosis further can lead to pulp stones. Pulp stones are also calcifications. What type of calcifications they are? They are associated with dead and degenerated cells. They are also coming under dystrophic calcifications. Okay, right? So dystrophic calcifications are seen in dead and degenerated cells. They are originated with the dead and degenerated necrotic cells. Other important area, whenever they're talking about calcium metabolism, whenever they're talking, because calcifications are associated with calcium metabolism. So whenever they're talking about calcium metabolism in dead and degenerated cells is normal. Calcium serum levels are also normal. Normally, calcium serum levels will be 9 to 10 milligrams per deciliter. This is a normal value in the human body. So when I'm talking about dystrophic calcification, they are basically dead and degenerated cells. You have dead cell on which over a period of time the calcium will get deposited. It is not because of abnormal calcium metabolism, or it's not because of abnormal calcium that is present in the serum. Normally dead and degenerated cells are there. Calcium will flow and calcium will get accumulated. So there is no abnormality. So calcium metabolism and calcium serum levels are normal in the case of dead and degenerated cells. Whereas when I'm talking about metastatic calcifications are basically associated with abnormal calcium metabolism and increasing in the calcium levels in the serum. Calcium levels in the serum will be increased. So that is a primary case for occurrence of metastatic calcifications. Means the calcium levels in metastatic calcifications will be more than 9 to 11 milligrams per deciliter. Whenever calcium levels are less than 9 to 11 milligrams per deciliter, preferably 6 to 7, less than 6 to 7, that particular condition is called as tetany. That particular condition is called as tetany. Okay. Now, normal calcium levels 9 to 11. Calcium levels are high, that is called as hypercalcemia. That can lead to which type of calcification? That can lead to metastatic calcifications. Calcium levels normal 9 to 11. Whenever it is less than 6, it is called as tetany. It is called as tetany. Now, you are very clear. So, dystrophic calcifications are basically originated with dead and degenerated cells. Pulp stones are best example from dentistry point of view. Okay, and your calcium metabolism, calcium serum levels are going to be normal. Metastatic calcifications will be on other side. Okay, now the most important area is most important area is examples of abnormalities. Very frequently asked INICET question. That too, most of the questions which are given till the date in INICET, both for the medical as well as dental, are moving around the examples of metastatic calcifications. Dystrophic, I told you, dead and degenerated. Necrosis, dead and degenerated. Infracts, dead and degenerated. Thrombi, dead and degenerated. Old scars, they have necrotic cells. Calcinosis cutae and sclerosis. Mockenberg sclerosis. Okay, so please do make a note of this because these examples are given in your Robbins. Now I want you to focus on metastatic calcifications examples. Very frequently asked. One is hyperparathyroidism, calcium abnormality. One is second thing is bony lesions like myelinomas, metastatic carcinomas, and all these conditions can lead to abnormal calcium in the body that can cause metastatic calcifications. Immobilization, metastatic calcification. Hypervitaminosis, vitamin D. Hypervitaminosis, I told you, it is seen in two vitamins. One is vitamin A and one is vitamin D. Whenever there is increasing in the vitamin A, abnormal vitamin A, which cells will get damaged? Again, INICET question. Abnormal vitamin A in the body, which cells will get damaged? Which cell organelle will get damaged? Just drop me on the chat box. So you have vitaminosis, hypervitaminosis can occur in A and D, and hypervitaminosis D, that is mainly inclined with the calcium metabolism, can lead to metastatic calcifications. And second one, a very frequently asked example is milk alkaline syndrome. Milk alkali syndrome is one more example of metastatic calcifications. Yes, vitamin A abnormality or excess of vitamin A can lead to cell organelle damage. Answer is lysosomes. Answer is lysosomes, because your beta carotene, which is present in your vitamin A, is going to increase the lysosomal hydrolysis enzyme. So whenever your lysosomal hydrolysis enzymes are increased, these cells have a habit of breaking cell walls, breaking lysosomes. So lysosomes will get damaged because of the activation of lysosomal hydrolysis. Of course, the lysosomes are, apart from this, they are called as suicidal cell bags, or the cell or cleaning crew of the cell. So they are going to clear everything which is present, everything, foreign bodies and everything which are present in the body will be removed with the help of lysosomes. Okay, so yeah, fine, I told you it is going to be a half-an-hour session. I'm done with the topics what I have listed out. If the response is good, I'm going to come live and take very commonly repeated areas for the upcoming days before you take INICET. Okay, so again, make sure you subscribe the channel, keep your bell notification on, and hit a thumbs up like to this video once you're done with it. Hope you have got some knowledge over this. We'll be coming again tomorrow with one more session covering few more important areas which are important for INICET. Signing off, Dr. Srikanth from Team MDS CONQUER, and people who are planning to register can contact, yeah, can go into the website and get registered. You'll get access to all the previous year questions, mock series, test series, and everything are there. Okay, right? So if you have any doubts, you can contact this particular number regarding the prep and everything. Okay. Yeah, we are always available to help you out, guys. So make sure, try to take your preparation in a smoother way and a sensible way in the next couple of days. Bye, take care. See you.